In my first video called From Doctors to Social Workers, I discussed how we distorted the term population health from a tool to improve health by enacting policies to buying and selling the health of a population in a marketplace. In this video, I'll look at how politics directly and indirectly affects our health. Welcome to PCP Lens, where we journey through metrics, money, and madness. My name is Sudeep Bansal, and I'm a primary care physician in Connecticut, and I run my own medical practice. Of all forms of inequality, injustice in health is the most shocking and inhumane. And the injustice is often directly the results of political actions or inactions. For example, hospital closures in rural parts of the country forcing people to travel hours to the nearest emergency room, or people having to choose between medication and food, or working mothers losing access to health insurance because they forgot to file forms to prove that they have a job. All of these are direct results of political choices that our country has made, leading to systems that we built, which directly or indirectly result in the health inequities that we see. In my last video, I discussed commercial determinants of health. In this video, I'll discuss political determinants of health, which are upstream from both social and commercial determinants of health. Let's dive in. Let's start with the definition, and it's quite a mouthful. The systematic process of structuring relationships, distributing resources, and administering powers operating simultaneously in ways that mutually reinforce or influence one another to shape opportunities that either advance health equity or exacerbate health inequities. In other words, it's the study of how politics interacts and affects our health. There are three major political determinants of health: voting, which shapes who we elect and how responsive they are to the people that they represent. Next is government, which may be national, state, or local, and is responsible for enacting, enforcing, or ignoring laws. It is the operational body which translates votes into action. And finally is policy. It is the output of political processes such as laws, regulations, executive orders, and funding decisions. It is how the government's will is implemented in society and through which the health of the population is shaped. When we vote, it elects people who then determine what kind of health decisions are made or not made. When more marginalized people are allowed to vote, their voices can be heard, which leads to improved healthcare access. When people are disenfranchised, creating laws that limit access to voting, such as voter ID laws or limited polling places, the elected leaders are not representative of the population and make laws favoring people who elected them. Therefore, expanding voting access, especially to marginalized populations, impacts their health. The government enacts laws which essentially translates these votes into action. Examples might include zoning laws in a local area, which limits fast food restaurants near schools, which may then decrease childhood obesity. Or build an environment with walkable neighborhoods, allowing people to get exercise. Or remove barriers to access to healthcare, such as work requirements prior to getting insurance. And the last determinant are policies enacted by the government, which affects the health directly. So for example, the Clean Air Act led to reduced pollution, which improved respiratory and cardiovascular health. Another example is a 3 strikes law sentencing law, which was designed to deter crime, but instead led to mass incarceration and disproportionately affected Black communities. Let's connect the dots between voting, government, and policies. When minority groups vote in large numbers, the elected officials will reflect the needs of that population and enact policies that will benefit the health of that population, such as expanding health insurance coverage. However, the system can be hijacked and thwarted at any of these steps. For example, disinformation can mislead the public about what really increases the total cost of care, such as people are lazy and don't want to work and they want free healthcare. This may lead to critical programs such as Medicaid being dismantled. When people start getting upset because they no longer have access to healthcare, then political actors shift the blame to people for making poor life choices or to doctors for trying to take care of sick people. Because who knew that sick people need more care and they're much more expensive to care for? After hearing all this, you might be getting a little depressed, especially given the political environment. However, there is a way out. It is called health in all policies. In a nutshell, all it means is that we should consider the impact of health on each and every policy that is enacted, even if it is not related to healthcare. The idea that governments profoundly influence the health of the population has existed for a long time. This concept has its roots in the Ottawa chapter of health promotion in 1986. This concept then gained prominence with the 2006 Finnish European Union presidency, which led to the collaboration between the WHO and the Finnish government, culminating in the publication of Health in All Policies report. Essentially, what the charter and the report emphasize is that there are some fundamental conditions that the government must provide or facilitate in order to improve the health of the population. These include basic needs such as peace, shelter, education, food, and income, a stable ecosystem and sustainable resources, social justice, and equity. Without these underlying conditions, it is very hard to build a foundation of health. Let's take the example of zoning laws and apply this concept of health in all policies. Traditional zoning laws in the United States have favored single-family homes, which has led to lack of housing diversity and affordability. Limited housing supply leads to housing shortages, raising costs and worsening the housing crisis. People living in single-family homes have larger commutes, and it also increases residential segregation. The impact of these zoning laws affects health by increasing stress and health inequities for people who cannot afford housing. Now, let's take the example of a progressive zoning reform that allows for mixed-use development, combining residential, commercial, and community spaces. This allows for increased density, including multifamily housing units and accessory dwelling units for families to stay close together, which decreases loneliness by increasing social interaction. Prioritizing the zoning for walkability and transportation allows people to get more exercise. Developing communities with this kind of zoning reform allows for improved access to food, jobs, and healthcare, which impacts health and improves health outcomes. Another example of health in all policies is the US Department of Energy's weatherization policy, which provides assistance to people to install better insulation, HVACs, which then improves their air quality. This then improves the health outcomes by reducing respiratory and cardiovascular-related illnesses. Let's connect all the dots. Political determinants such as zoning laws create vulnerable areas. Commercial actors such as fast food companies target these low-income neighborhoods. In these low-income areas, there are limited food options and people gravitate towards cheap fast food. This then increases obesity and chronic disease rates in this population. Essentially, political determinants form a causal and hierarchical relationship with the other determinants of health by creating conditions for risk factors for poor health. Commercial actors acting as commercial parasites swoop in to extract profits from these vulnerable populations. This then creates inequities shaped by political and commercial decisions. These systemic influences from political, commercial, and social determinants determine health outcomes. Individual choice is just an illusion, similar to the recycling example that I gave in my prior video on commercial determinants of health. So where does this leave doctors? We need to understand that the political environment dramatically shapes the health of the people that we are trying to care for. We are constantly asked to stay neutral and stay out of politics. But just taking care of patients isn't viable when most of our sickness is driven by upstream factors, especially when we are made accountable for quality measures and value-based care, which ask us to address upstream factors of political and commercial determinants of health, which are completely outside our control. So as medical professionals, what do? If you're not at the table, you're on the menu. And we've been on the menu for a long time, which is how we got all the quality measures and value-based care. We all need to understand how political factors shape the health of our patients. We need to educate and share knowledge about these systemic health barriers with each other and with our patients. And we need to advocate for health policy that improves the health of the population. Please share the article on the website or this video with your colleagues so that we can raise awareness about how we can lay down the foundations for a better healthcare future. You can find a written version with references to the material and an audio podcast version on PCPLens.com. If you like this video, please sign up on PCPLens.com so that you don't miss the next episode when it's published. Thank you for watching this video. Take care and goodbye.